almost 10 questions that you have been asking me when I've been going live. And so today I decided we come with here and answer them. So, are we ready? I don't want to say where we are until tomorrow you say we are ready. Are we ready? So we are ready in Facebook, we are ready in YouTube, and we are ready in TikTok.
Yes.
Hi guys, how are you? Paris Boothia here and Dr. Maina. And for those who've been following us, if they've followed us, they know Dr. Maina and I have been doing a few series because that's why they've written to me, Dr. Maina.
Oh, yeah.
Dr. Winnie Maina, by the way, you guys have written to me because we have done a few series before. And so I said today we go live. So she answered them live. I suppose we video and then you wait for another 1 week. See, afadhali leo wasijue live. So where are we? Wait no more. Drum roll, please. Gerard, refine, revitalize, rejuvenate, dermatology consultant and aesthetic. We came at Dr. Winnie Maina Clinic. But before we start, there's something I've never asked her. Until today, by the way, we sat here and I asked, what does Gerard mean? Dr. Winnie Maina. Seriously, it's not called Dr. Winnie Maina Clinic. It's called Gerard. What is Gerard?
You've never taken a guess. Or
No.
It has never crossed your mind.
Imagine
what
it has
could
never.
mean.
Is it Arabic? Is it Swahili? Is it?
Jalad is that actually means skin in one of the native Egyptian languages. Yes. So when I was starting the clinic, I was looking to something that can tie in what we do. It means skin. But then Egypt is very rich in history about cosmetic medicine, science and all that. If you read much of the history, you'll see even where women used to use
Milk to bathe.
Yeah. Why? Because of lactic acid in the milk.
Yes.
So it has very rich history in terms of skin, rejuvenation, medicine, and that science. So that's why I picked that.
Wow.
It presents who we are, skin.
So guys,
Yeah.
welcome to Gerard. And it's, as you can see, we made sure today we're doing it here so you can see exactly where we are. So when she answers you, she's not answering you from the street. No, from her clinic where she actually treats.
Kabisa.
So now guys, and as you can see, we have Scarred and Skin here, the book I've written, and that's why we started this series, me and Dr. Winnie Maina, to answer your question about this book, because we said this year we are healing out loud together.
Absolutely.
And Dr. Winnie Maina was kind enough to say that I'll walk this journey with everybody who want to belong to this community. So we are building this community together. Me and Winnie Maina, we are building this community we are calling Scarred and Healed. We came from Scarred and Skin, Scarred and Stories. We tell ourselves to Scarred and Healed.
Yeah.
But how are we going to get healed, Dr. Winnie Maina? Now, let's go straight to there, because I know people are wondering, is she going to ask about my question that I've,
gathered.
yeah. So number one question, Dr. Winnie, is our skin carries our stories from stretch marks to scars. Why is it important that we seek skin, we see skin not just as appearance but as memory and identity? For example, somebody who has, which we're going to get to that question also, who has keloids that were formed because of ABCD, how are they supposed to see their skin as an identity, not as a shame, basically, because the book we've written is about that. So how are they supposed to now move from, this is scars that give me, I feel ashamed of, to, it's my story, it's my strength, it's my identity. Before you, then the next question attached to that will be, what causes keloids and how do we prevent them?
I see. That actually tells whoever asked that question, they're very unique. The skin, we wear the skin, scientifically skin, and we'll keep describing for you what skin is, what skin does. But as individuals, skin is also very, very unique. That is why you'll have Paris and myself, probably you have a few of stretch marks someone else doesn't have, right? But I think the reason why it feels like you're scarred is because of the definition that has been put in our minds and our brains by the societal expectations.
True.
Right? So we forget, what is this story that your skin is telling? What is it unique? Is it about genetics? We're going to be talking about keloids. That tells you you're a very unique, special individual. But if I would just go through the stretch marks, there are seasons. You'll see stretch mark in children as they go through the puberty.
True.
You'll see stretch mark in adolescents as they grow through the growth spurt.
Mm-hmm.
You'll see stretch marks in pregnant women as they bring forth life, special life. And you see stretch mark as we try to navigate weight. And it's also possible to see stretch mark as a result of a medical condition.
True.
So you see the uniqueness in all these people. So there is no way we are going to sit somewhere and say, we expect our skin to be flawless and not to have stretch marks. We are all going through different seasons for different reasons, but stretch marks will be there as either physiological, something is going on, or pathological, because there can be even illnesses that give you stretch marks.
Mm-hmm.
Yeah.
So once then I know why I have them, how should I deal with that to accept that this has happened? Because let's agree, Winnie Maina, is there a way that stretch marks or scars can completely be removed?
I'll be lying if I said yes. So it's a no.
So no.
I know it doesn't sound
Can be
very
minimized,
promising.
but it cannot.
It can be
erased.
minimized. We can improve. But if I sit here and tell you that I'll get that skin to how flawless it was before the stretch mark, it's
a lie.
A lie.
And that's why I love you, because me and you, we tell people the truth. Yes, we want them to come to this clinic. We want them to come to our clinic. We want them to go to other clinic and seek help. But it's important for them to know. Mm-hmm. If somebody is telling you that they will erase them and you never see them again, they are lying to you.
Yeah.
Be listening to a doctor who's telling the truth. He said, I will manage this for you. We will reduce it. We'll minimize it.
You said it, manage. Reduce, minimize, so that you can at least feel a little more comfortable to wear them. Remember, some, especially the ones that appear early in life, the adolescents, the young children, or the girls' growth spurts and all, over time they fade
away. Yeah.
Over time.
Yeah.
So it's not going to be a month, 2 or 3 months.
Yes.
Over time,
yes.
they fade away and they become even, you may not see them clearly.
Yes.
So it's reasonable and very rational just to mention it. They rarely go off completely.
True.
Yes.
Now, keloids. A lot of people, of course, you have to know this is something that you will know until it has already happened. There are some people who are just prone to keloid, period.
Yeah.
A little thing. I know I'm one of those things. Like you can see right there.
Wow.
That's when I was young. I think I was playing with my cousin and I was cut and the keloid formed. So you don't know whether you are prone to them until the damage is already done and is formed, right? Mm-hmm. So what would you say is the best way to prevent those ones?
So keloids, like what you're showing me, is something we call the hypertrophic scars.
Yeah.
Keloids and hypertrophic scars are different.
Yeah.
And how they form is totally different. The hypertrophic scars, quote unquote, they don't grow beyond the site. They don't go beyond the site of injury.
Yeah.
But keloid, they're also hard, tough, and they can even overgrow to some extent. For keloids, you may even see them in the family members and all that. But both of them likely form in the areas where your skin is very tense. And that's why you find them mostly in the areas where the skin is not stretching as much. Your chest, your shoulders, or even around the ears.
Yes.
Right? And even when we're trying to manage them, because even when I'm doing the excisions and all that, the triple therapy for keloids, we're very candid with the patients or someone who is seeking help. Chances of recurrence is also very high. Because it's just a genetic makeup in a way that there's a dysregulation in how your skin heals. Mm-hmm. It heals by depositing so much collagen, fibers and all that. You end up with that. So if we manage, and there are mechanisms that we apply to manage it and ensure at least you get the results and hopefully doesn't come back. That is what we aim to. But if it does come back, don't beat yourself so much, because there is nothing much more you would have done beyond that. Yes.
So should they own it? Like if you already got it, it's already have happened. You've gotten a scar, you've explained it so different, the difference between the two. And so should I just own it and know this is my truth and live with it?
Not absolute forward that they should own it.
Yeah.
What we own depends on how we feel about ourselves, and that's why as medical professionals we come to play in the aspect of aesthetics that you see. Our primary goal is not to tell you that you don't look good, you're not okay with keloid, or you're not okay with hypertrophic scars. We're here just to create a space where you can professionally get help, right? So for a person coming telling me, Doc, I have keloid and I want to get rid of it, my primary role is to make sure they get rid of it in the right way. Because if I send them back and tell them own it and they don't feel okay with it, I'm not helping.
True.
That answers the question you're talking about. Isn't it controversial that we are telling people to embrace own the scars,
and at the same time we treat?
And at the same time we treat. We treat to make you feel a little bit of yourself if already you are not feeling okay where you are. In fact, the thing could be, are we or people around us the ones making us feel not that we right? Because I could have a keloid and I'm just fine.
And you're just fine until somebody mentions it.
Until someone mentions it. And that's now the context changes. And that is what we're talking about, the societal expectation of how we should look like. That is the narrative. What we portray is what we should try change more than how people access healthcare, because it's part of healthcare.
True.
Yes.
So, like I said, today, guys, I'm being honest. I'm like your advocate. I'm leading your question, and we have Dr. Winnie Maina answering, right? So, what exactly happened in the skin when stretch marks, burns, or scars form? What is exactly going on? Some people think it's their fault they have stretch marks.
No, not at all. Especially stretch marks. Our skin is elastic, and it has 3 layers: the upper layer, the middle layer, and the lower. Stretch marks actually affect the middle layer. That's why we have collagen, elastin, and all that. So if you're going through a season of something that stretches that skin beyond its capacity
of elasticity,
the fibers of whatever we're talking, it tethers, right? So it has literally, you tear through those structures we're talking about. So that's what happens. So it could be an excessive stretch when you're adding weight, or even when you're having excessive weight loss,
or when you're adding muscles,
especially even I've seen it in the gym. In the gym, it has also been associated especially with the use of anabolic steroids, because there are people who use the anabolic steroids to gain the muscle and all that. So you can see them even in bodybuilders or people who use anabolic steroids. So that is what happens with stretch marks.
So it's important that people who are watching us to know this is not just a women problem.
It's not a women problem.
It's actually everybody.
Yeah, the majority will be women, 70, but we have a 30% of men, even young boys and men having stretch marks. It's not an isolated women problem.
Exactly. Because when we're talking, men might be, are they talking about us? Yes, we are talking about you. We want you to get educated too. Now, the next question, Dr. Winnie Maina, and I hope if you have questions, please, this is not a monologue, it's a dialogue. Light your question right there. Shan is right behind the camera, by the way, in case you're wondering whether there's somebody who can see the question you are, because I might not be reading them, but she's there and she'll let me know if there's a question that we need to answer. So please do ask your question. Ask your questions, please, 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 so that we make sure that we're answering your question. So the next question was, people often search for quick fixes. Are there safe, effective treatment to improve the appearance of scars, marks, or is it more about managing? I think you've already answered that. Honestly, she answered that. You said when people come to you, you try to help them to minimize it, and Cindy, and it's not bad. So I think you answered this.
I think maybe something we skipped is when you said we have stretch marks, then there is the scars, hypertrophic scars and keloids. And if I remember when we were training, even when we're doing our internship, there is always a burn unit. I don't know whether you remember Kenyatta or any level 4, level 5 hospital you go, you find a burn unit. And burns form the biggest chunk of the scars we see. Right? And globally, burns are a public health concern, because there are a lot of burns that usually happen. But what I'm excited about is our recent approach, especially in managing burns. It may not have happened way before
For-
in many years.
Yeah.
But right now in context, the doctors we are seeing, the surgeons we are seeing, the plastic surgeons we are seeing, they are very excited to just not look at the healing of this patient, but the quality of life
After.
which is very personalized. The quality of life after really matters. Remember, burns come in depths. The decrease of burn, the structures they have affected.
True.
So it's almost obvious that when you start managing these patients, we have the outlook of how will the quality of life
be affected after.
And we're always looking forward to making them better. I think we are advancing, and
Yeah,
I'm excited with
thank God for
technology.
that.
Yeah, it's not like
technology.
Before it was save this life. However, they heal, whatever they're carrying and whatever they have to carry, they could probably carry it for a very long duration of time.
True.
Yes.
Wow, that is really well answered. I really appreciate that. How do you balance the medical side of treating skin and giving skincare routine with the emotional side, helping someone embrace their skin story? For example, somebody has come to you, and honestly, you have the science, so you are treating them from the science. But at the same time, there are some things you are looking at them, you're like, this one, it doesn't need me to take you to theater for. This one, you need to. It's a home thing that you can manage. It's a home
remedy. You can remedy it.
Yeah. How do you balance that? When do you know when to tell somebody, hey, this one, we need to do something about it, or this one, just go home and use what I'm gonna give you prescription for, and it will be fine.
I love the fact that most of our consumers or most of our clients come in with some level of knowledge and also open-minded in this context. Let's say we are having eczema or we are having acne, and the first 5-10 minutes, Paris, let me tell you, we can already pick the emotional aspect or the emotional weight or the impact of whatever they are going through. Either they have tried to manage it, it's stressing them, or they have picked a few trends here and there, right?
True.
So as complex as it may be, most of the time we try explain it in so neat little details. I told you sometime if we need to use your mother tongue just to get you to understand. Sometimes
some things come out better that way.
They come out better that way. You can understand, or even diagrams or structures just to get you understand.
Yes.
Because an informed patient and a patient or a client who owns their own journey, I mean, they're beautiful. They are healed.
Yeah.
I could sit and have a prescription that could have even 5 ingredients. But if I assess your emotional well-being and I realize I give you the 5 you're not going to use, trust you me, we're going to start with 2. I'll call you in next week or in 2 weeks and
increase.
Bring in. Something else is that when someone comes in, maybe what we are seeing is not what brought them. Okay? We have seen people come with acne, but it's not even acne that is bothering them, it's the pigmentation. So the context into how I'm going to address this, I must like prioritize to deal with what bothers you first. Before I fix what I think in my head as a practitioner.
It's so true.
Is what really matters.
There's a line I've written in the Scarred and Skin book where I've said, the stories we tell ourselves, and the word flawless has brought a lot of people to our clinic than the skin condition itself.
Absolutely.
And look, and I'm sure you can bear me witness, I've written it in the Scarred and Skin book, like the story we tell ourselves and the word flawless, the way it is used out there, has brought a lot of people in our clinic. Then the skin condition they actually have, because like you said, you could be having keloids, you could be having scars, they don't bother you until somebody come and say, wow, those scars,
what
do you
happened?
know? And you know somebody can do something about it.
I know
these are the days where you don't have to be walking around. And right there and then, you are walking and minding your own business. And all of a sudden, all you can think about is flawless skin. And then the next thing you find yourself in Jalad asking Dr. Winnie Maina,
to get you
how do I remove this scar? Because it's bothering. But is it really bothering you, or is it somebody who said something? And that's why we are talking about this, Winnie Maina, because when people come to visit us in our clinics, we want them to come because they want to fix what it is they want to fix, not
And
because
for them,
and for
themselves, not
because somebody else called it, called it a name, and now they want to remove that shame that they are feeling because somebody else have seen that shame, and that's why I'm really appreciating you for agreeing to talk to those people, because let me tell you, for those who are online right now watching us, I can guarantee you, I don't know how many people are watching us right now on TikTok. How many people are on TikTok live? I am very sure out of those people, there is somebody for sure there is struggling with what we are talking about right now. Whether it's because someone carelessly used words like
flawless. But how would you define flawless, honestly, Paris?
Exactly. Why? That's where we are going. Now, when we tell people they need to have flawless skin, what do we mean, Dr. Winnie Maina?
That concept actually doesn't exist.
Doesn't exist.
The concept of flawlessness,
it is not there.
Because our skin will always wear some sort of history. The history we're talking about, the stretch marks, the history of scars. Some of us who grew up in the village. If
you look at my knees right now and don't look at them,
or Liverpool, my scrubs, there's history, right?
History.
And it can't be completely erased to get that version of flawlessness, unless you living in a world totally where nothing ever came into contact with your skin. There's history. Yes. And
lately, I am telling people watching us, and I think I did this on Saturday. I did a live, just because I felt like doing a live, and I was telling people that one thing they have to know in the world we live in today. We have filters. We can filter anything. I want you to not see this car, I filter it. I want you to not see this, whatever, I filter it. I want you to think I'm wearing blue instead of black, I filter it, and all of a sudden I'm wearing a different outfit. And a lot of us are getting confused with that. And we are starting to think those are real people looking like that. Yeah. Can you imagine? I've had people come in my clinic, Dr. Winnie, and they tell me, I want to look like this picture. When you honestly look at that picture, you're like, this picture is filtered. Mm-hmm. Now, how do you expect me to make you look like cartoon? Because literally, you get. Yeah. So, I need you to talk to that person who is looking at us right now and thinking, you guys, you don't understand. Because I'm telling you, I've had people lie to me and telling me, Paris, but you don't understand. I just want, right now, flawless is a currency. And for me to feed my children, or for me to pay school fees for my sibling, or for me to wherever, I need this flawless skin. I need to bleach my skin. I need to do whatever I have to do. Because right now, this is the currency. How do you talk to that? From a doctor's point of view, what would you tell to that person?
I'll pick it first from the professional perspective. The skin, or what we'd like to say about it's a very functional organ. It's like you trying to tweak your kidney to perform something else totally different, right? And it has its absolute functions. And we say it again here, the cosmetic purpose of your skin is probably among the list of the functions that it has to do.
True.
It's protecting yourself from the sun, it's regulating your body temperature, it's helping you move around because of its tensile strength, and then cosmetic issue come in, right? So if we rush to trying to amplify its cosmetic function, are we moving to the expense of these other very functional functions, the core functions of your skin? I bleach it, I reduce melanin, you get sun damage, right?
Now wrinkles.
Way later, right? I bleach it again, you get irritation, dermatitis, hyperpigmentation. So you say, we're rushing to amplify one, but you mess around with other very core functions of the skin. Okay. Let me come to the personal perspective, or a humane answer to that. We do not condemn or ambush or shame anyone who requires or feels the need to improve their skin somehow. But the biggest advice I will give, what exactly are you trying to achieve? Is whatever you're trying to achieve reasonable, and is it at expense of your health. If you come to me and whatever you're trying to achieve is at the expense of your functional health, I will not do it. I may not be your best choice of your practitioner, because then what exactly do I aim at achieving? If what you're trying to achieve, is it going to give you permanent results? Or are you going to keep having to do this? And what is the end result? Those things it's a very tricky balance. We still want to hold your hand in the aesthetic space for you to look at your best, that you feel is the best. But we must be able to do it very professionally and ethically. If it crosses those barriers, then we just shake hands and say we met, we were good friends, but this is not for our space.
Go seek help somewhere else. That's why we are doing this, Dr. Winnie, because the truth of the matter is everybody is allowed to live their life. True? Yeah. Your life, your choice. True. Your skin, your choice. So whatever you want to do with your skin, it is your choice. However, we as professionals, we just want to tell you the truth.
The truth, yeah.
And so that when you make those choices, you make them knowing, I am putting my body in risk, but I want to do it anyway. I am compromising this, but I want to do it anyway because it's making me happy, it's making my life. But do not say you were not given proper professional guidance about it. Informed advice.
And most of even the procedures you will ask, or you're asking for, will give you something called informed consent.
Yes.
You so come in to me, you want Botox, you want fillers.
Do you know this will happen? This is a side effect. Are you okay
I'll do it professionally.
Because let's face it, Dr. Maina, I'm liking that you said that. Winnie, is there anything that doesn't have side effect? Very few things. Because always, even when you go for surgery, kuna ile form you have to feel.
We always have to do
that. You could die during. I know I've actually felt that personally when I was doing a C-section for my 2 babies. I literally had to sign a form that I could die during. So now you are like, okay, the baby has to come out. I could die. So do I say no? No. So you have to just sign it. But at least you're going in knowing, informed that in case we are professional, but in case for whatever reason something go wrong, you knew this could happen.
These are possible side effects.
So long as it wasn't
and
careless.
The consents don't really mean to scare you.
No.
Or to scare the life out of you.
True.
The consents mean, we call it informed consent, because you're coming from a consumer perspective.
True.
You trust me as your professional to give you the right information, and that's my primary role.
True.
I'll give you the information, so I must make sure by the time we're doing what we're doing, we have the informed consent. I didn't just ambush you and look at you, hey Paris, you need
you need to sign this.
No, it's a conversation happening during your consultation, and we do it and we support you. We mean actually the best for you, even if you sign that consent.
Very true. And it can be scary time, because honestly, I remember my first baby, it was either me or her, and my husband literally was made to choose. Sign here.
Choose.
You could lose your wife or your daughter or both. Now sign here before we. You get what I mean? It's a very scary.
It's a very scary
but
situation.
They do it also, like you say, to inform you that in case something go wrong, we had already informed you this thing. So me and Dr. Winnie Maina, we are not coming to scare you. We're coming to, because sometimes you might do this thing and it look like, hey, are they doing this life to scare us off for things we do or what? No, but we are honestly just trying to educate you, and we're not saying whatever you're doing is wrong. No, again, I like what she said, but I also keep on saying every time I do these lives, what is your why? Make sure your why is very clear, why you're doing anything that you do, any skin treatment you decide to go for. And once you know your why, is it because of peer pressure that you're doing it? Is it something that will matter 5 years from today? Or is it something you'll regret 5 years from today? Isn't it important to ask yourself, especially when it comes to aesthetics? Now, I'm not talking about now diseases. I'm talking about aesthetics. Yeah.
Yes, and aesthetics are very interesting, because I love when we're discussing aesthetics, because most of the consumers have information. And I've even written some sticky notes to my clients. You came in for this, yes. Do you know what it is? We have through the conversation. I tell you, I'm not going to offer this service today. We have gone through the much we can. Take this with you. Try find out more. So that we're coming from a situation whereby both my client and myself understand comprehensively what we are doing. I don't want to do a procedure today and then 2 years from now you're like, oh doc, you duped me into having something that I really don't like now. And then what is the effect? What are the results? And everything, we have very beautiful, amazing, reasonable procedures. But you must have the information.
The information is very important.
Very
Educate
important.
yourself as a client. Let's
Yes.
see the other question. Do you believe scars can be celebrated as a symbol of strength and survival? And read more. What practical advice would you give someone who struggles to accept the scars or marks on their body?
What practical advice?
Do you believe scars can be celebrated as symbols of strength and survival? What practical advice would you give someone who struggles to accept the scars or marks on their body? Because, like we said, some people even is birthmarks. Let's even go that. Like, I know my daughter was born with a birthmark on her thigh. It's weird, but she do have, and the same birthmark, to your surprise, her father has it. By the way, can it be genetic? No, you see, now we are going somewhere now. As I'm asking you question that I was asking,
Things are coming
I'm
by.
also asking, oh, is it genetic? Because it is in the exact place that, you know, it's in the dad's thigh, and now it's in my daughter's thigh. She was born with it, and it bothered me when she was a baby, because guess what? Telltale sign. They're called tails, whatever they're called. Apparently, according to African women, then when I ask the older women, because I was young when I had my first daughter, they said I was drinking hot tea. Before I knew my husband had it on the same. Oh, Paris, you must have been drinking a lot of hot tea. Hot stuff, you chomed your child, you burned your daughter thigh. And then I realized my husband has the same. And I was his mother also drinking hot tea
and burnt him
and
as
burn
well.
on the same spot? It is not a hand, it's in the same spot. By the way, as you answer those
I
questions.
answered those questions. The nevus or the birthmarks, that tells you how genetics can be very complex. You can see something in you, don't spot it in your immediate member of the family. You can even move to the third or a third previous generation.
Yes.
And they are harmless. They are totally harmless. Or it appears in certain spots in your body. For the other child, it's somewhere. Even my son actually has a birthmark that I also have, and the other one has, but at different spaces.
Yes.
But they resemble each other, even the color.
Ah.
And they don't know it. I've never even mentioned, because for them, the two boys, it's on the back. Like, I don't want to mention it. It will just intrigue
Plain
something.
their minds, yeah.
Like,
I didn't even know I have
mom?
it now. Yeah.
What is it that mom spotted?
Yeah.
So you don't mention it. But coming back to how do you celebrate scars? I live in Kajiado, and every day I'm walking around, I see the Maasais. You've seen the traditional marks and the way they wear them with pride. Because for them, it's the mindset, the mental aspect of what is it for, what does it stand for. For them, it's cultural, maybe initiation, transitions into different groups, and even they went through it through pain. But it has a mindset of whom they recognize themselves for. So if you scar your stretch marks is from childbirth, that scar or that childbirth, pregnancy stretch marks reminds you of that a baby. So that person asking, how do I embrace them?
How do I embrace it?
What do they remind you of? Do you feel comfortable? If yes, then you have to start thinking and affirming yourself. This is what it reminds me of. Is it something worth to remember? You keep them. If you're not comfortable, we're here as professionals to help you at least manage them a little bit to feel better. Yes.
Now let's move to, as we cross from the scars of physical scar, let's talk about, as the book we are discussing right now, scarred and skin. How about those scars that are emotional, that nobody sees? and they are brought by some scar that are physical. But I pretend like I dealt with my physical scar, and now I'm assuming it doesn't bother me, and I come out like it doesn't bother me. However, emotionally,
It does.
it does. How do I deal with that?
It does, and it's a journey. It's like a journey of loss, and let me refer to it as something we call ambiguous loss. You can't quantify what exactly is making you feel that way, but until you process it, even embracing the physical scar is going to be very hard, because chances are you will even start projecting
To others.
You'll even, I look at parents and I'm like, oh my goodness, I love her skin, but then I remember I can't even wear sleeveless because of my hands. Maybe my hands have stretched. But when I look, I'll start projecting. So like any other loss, grief, or any mental illness you're going through, you have to process it. There's no shortcut. If we come in and fix it before we process the cause, we'll never win. So sometimes we, or myself as a practitioner, may not be able to help you individually, and I'll need help.
Yes.
I'll need help. If I have to call out a psychologist, psychotherapist, to unpack your emotional weight before we deal with the physical scar, then that is what we have to do.
And for our community who are watching us right now online, TikTok, hi. Facebook, hi. YouTube, hi.
Yeah, many.
Do we have people joining us, by the way?
We have people.
TikTok, tuko na wangapi?
We'll look afterwards.
Okay.
But they're still joining.
They're still joining. If you just joined us, by the way, I'm here with the beautiful Dr. Winnie Maina. Today we decided we're going to come live so that we can honestly answer this question that you've been asking me. Remember, I told you guys, we want to build a community called Scarred and Healed. After we've been scarred, we want to heal. And me and Dr. Winnie are committed to doing this. And I asked you on the last live I went alone, and that's why I decided to go with Winnie Maina, so you can hear her saying with her own words that we're going to do this together. I ask you, would you love us to schedule a meet and greet whereby me and Dr. Winnie Maina, it doesn't have to be even this month, next month, but within this year, where we actually do an event for Scarred and Healed, where you, instead of you coming the way you're coming live right now to talk to us, we will be talking one-on-one, where she can tell you, hi, how are you? And you talk one-on-one, and she give you advice one-on-one. So I am planning to do this with Dr. Winnie Maina. If you tell us yes, when we see the number, we might even decide to do it in late October or early November, or November, December there, where we honestly will meet this community. Whether we'll be 50, 100 of us, 1,000 of us, we're going to meet. We're going to eat and drink together. We're going to learn together. And then we equip each other. And we build this community whereby you have professionals who got your back. When I need, sindio?
Whatever you need. Yeah, sure.
Imagine niliwaambia na huko umenipatia permission. Sasa nikakuseti. No, we come and say
I agree. So
because we're building this community together.
Okay.
But after we've built it, right? For example, now on YouTube, I have over 20,000 followers on YouTube. And these people, I feel like I owe them a meet and greet where we meet them. And this advice we've been telling them, now we celebrate them, because did they use the tips that we've been giving them? Were they healed? Yeah? And maybe they want to become your client, but they don't even know where to start. But when they meet you now and they connect, because sometimes, let's face it, you have a clinic, I have a clinic, and we know a lot of people connect with the person,
the individual,
not even the treatment you offer. So when we meet them now, we connect with them. These people maybe will even be open-minded now to come and speak with you one-on-one. I supposed to just write to us, and then we come here and give this advice. Do you agree?
I agree.
I look forward to that.
I agree.
I am looking forward to that, guys. See, me, I'm here. I told you, I make sure that you will meet Dr. Winnie Maina one day, one-on-one. Whether you come to her clinic at Gelad, by the way, she will tell you right now, as we finish, by the way, she'll be telling you where you can find her. If you wanted to connect with her one-on-one, if you have an issue that you feel, I must see a dermatologist for this issue, she'll tell you where you can find her. Because we don't just come here so we can just, it's not about entertaining you guys. Honestly, we are committed into making sure that you get healed, whether it's physical scar, emotional scars, financial scars even. The day we do this meet and greet thing, we'll have all those scars covered. Whether it's financial scar, we'll have somebody talking about finance there that you're struggling with. Sindio?
Yeah.
Whether it's about relationship scars, we forget those are also scars. Mtu aliashwa kwa nini altar. I've heard these people who've been left on the altar. You get, we'll have that person. Aki, we got you. And I'm going to start talking about this more in my social, and we're going to start organizing this event. Let's already decide here. Let's decide together. Facebook, hi. Hi, TikTok, hi. Let's decide together. We're going to start organizing this event together, and we do it together. Why? We want to heal out loud. I'm going to keep on saying that. This book was written for you and me. Scarred and Skin is not just about me making money. By the way, it's not about that, no. But honestly,
it was amazing. It was an amazing set put together.
It was for you to start this conversation that I feel like people are afraid to have, and to make sure that they have a safe place where actually professional can give them.
I actually hope even your viewers, your followers have read it, because it doesn't set us aside. You remember the professionals who struggle with the same skin.
There is that. Able to tell them about that chapter where we've talked about when professionals don't feel pretty.
When professionals don't feel pretty, I'll wake up, I don't feel and look the best.
Do you always feel like you look the best, Dr. Winnie?
No, sometimes you wake up and this everything has just said like there's one just started in the morning. We human beings, beyond us having the knowledge, the skills just to make the best of skin to our clients, we are human beings. And let's extend some grace to your estheticians, skin consultants, dermatologists. They are human beings. So we are not unique. We are not special. We do go through these things as well.
I like that. And so, she's almost lapping it up. So if you have not gotten this book, by the way, tukua tumeiweka hivyo ndio muione. Achaneni na hii, ignore that. Scarred and Skin. If you have not gotten this book, it's available where? Hekaya Bookshop. It's also in Nuria Bookshop. And it's also at parisboothia.com. You can get it there. Or you can come to the Outer Timeless Medical Spa. You can get this book. And it's only $1,500. And I swear it's not about money. Even if you came and told me you only have I have 1,000 Paris and I need this book. Imagine, you'll still get it. It's not about, I need you to know that. It's not about money. If you need this book in your hands and you have 500, come to me at Timeless Medical Spa. Tell me, Paris, I've come. I have 500. Give me the book. I want to heal out loud. We'll give it to you. But better yet, you need to start working on yourself. Listen to this. If you would just join us and you didn't listen to this live from the beginning, it will be on YouTube. Go there. We're going to cut it in small and post it on her TikTok, my TikTok, Instagram. I'm going to do a collaboration with her. We'll post it on Instagram so that if you miss the nugget she talked about, you will get it there. Cindy or Dr. Winnie Maina. As you join our community, we're trying to build a community. Promise me, you guys. I have almost 50,000 followers on TikTok. Imagine if just 30%, 40% of you decide to join this conversation of scarred and healed. We can have a very strong community, and through that community, we can heal so many other people together.
Even a future generation.
Exactly. And you who is watching us right now, and you are professional, maybe you can come and talk about scarred and relationship, scarred and finances. Seriously, we need them. My goal is to one day have a panel of about 6-7 people talking about different scars that we. Dr. Winnie is kind enough to talk about skin scars. Yeah, we want somebody else to come as a psychologist, talk about emotional scars. We want an accountant, somebody who is good in that area, to talk about financial scars. Do you see where we are going with this? Would you want us to do this kind of thing? So if you really want us to do this, you know, guys, I listen to you. Aki, everything I do, including this life, it is you. It is you who tell me, Paris, you actually drive my life. Paris, we want you. This book was written because you kept on asking me a lot of things and I didn't know how to answer them. I thought I liked, yes. Wow. And so I can start having professional like Dr. Winnie Maina come and work with you. So, Dr. Winnie, please tell them where they can find you.
So you can find that across all social media platforms. Jalad Aesthetic Clinics, my social media platforms, Winnie Maina, Instagram, Facebook, and Winnie Dermatologist on TikTok. But our physical location is at the Family Health Plaza along Maimahi Road, off Langata Road at the Timwell Junction. You're most welcome. Interact with us and we'll be waiting to hold your hand in your skin healing.
I can't add any more. I think we'll edit here, but I just want to say thank you for joining us. And again, my name is Paris Boothia, for those who don't know me. And if you want to interact with me, Paris Boothia TV on TikTok, Paris Boothia on Instagram, Paris Boothia on Facebook, Paris Boothia everywhere. So let's interact. Let's continue, guys, equipping each other. Let's continue healing each other, because you know this is healing. A problem shared is a problem. So if you didn't know Dr. Winnie, you know Dr. Winnie now, right? If you didn't know Paris Boothia, you know me now. And so let's continue interacting in our socials and visit her in a clinic if you have a dermatological problem that you want solved. And you can lie to us right there. If you want her number, we'll put it there. At the bottom of this, we'll put it there. So you can call Dr. Winnie and you can be helped. But more importantly also, go grab a copy of Scarred and Skin. So as you join this community, you'll have read the book and you'll know what the book is all about. I love you guys and I always appreciate you. I honestly don't take you for granted, but we have to go back to work. Remember, today is Monday. We're in a clinic where we can see, you know, client walking in. We need to go back to work. So thank you. God bless you. Until next time.